When I first became aware that I had a mental illness, and it is an illness, um, I I was about 14 years old, and we lived in this house on the top of this mountain, Signal Mountain in Tennessee, and it was very remote, and we had no neighbors that were very close, and so it was kind of creepy. And it had been built by my stepfather after he'd come home from the war. Um, and so it was a very unusual house. And being in this house alone was just, it was creepy. I grew to love the house, and the house became synonymous with my being able to calm myself down later in life. I would remember the house and go back through it. I can walk through it today. I became extremely paranoid, and the house made weird sounds, and being out in the forest and all alone, and people would come, to our house sometimes, and scare. I would be scared because um, I was just I became paranoid, and then the anxiety of life, I guess. I don't know. I became claustrophobic. I couldn't stand being around a bunch of people. It was just I had a really hard time, and I wound up self-medicating. And so by self-medicating, um, I got into trouble because I was a young girl, and getting into trouble self-medicating meant um, my mother was involved, and I had to go to get some help, and that was when I first became aware that I had mental illness. I went to college. I've got a Bachelor of Arts, a Master of Science, and a doctorate in higher education administration and leadership. So college was where I could run to, and I did. And I always had a counselor at the college. So that was college was good because it kept me normal, or it kept me straight. It kept me involved, and so I always did really well in school. I became pregnant, and I knew I was sick. I knew I was pregnant, and I called my mother, and they had been practicing tough love with me to where I wasn't allowed to be in their house, really. I said, Mom, I'm sick. She said, I'm sorry. And I said, No, I mean, I'm really sick. I'm pregnant. And I got on an airplane and I flew out here with literally what I was wearing that day. I had the clothes on my back. I left my cat, the love of my life, Tupelo Honey. I left her. Uh, she was eventually transported to me, but I went into treatment. Never thought about drugs after that, or alcohol. Um, it was about my son. My son is why I'm in Camas. I worked very, very hard to get the job that I have now. I went to the agencies and I said, I want that job, because they had given the mental health ombuds for Clark County at that time, to 3 different people that were not local, that were not invested in our community, that were not people that really had any mental health issues. They were people that had family members that had mental health issues, and that can give you mental health issues. However, at that time, um, I knew I could do the job. I knew I could make a difference. I had worked with Clark County as the supported education liaison for about a year and a half, and I knew that I was the one to do the job. I've been the ombuds to Southwest Washington for 13 years. There's this thing inside of people that says, I'm not going down like this. In the beginning, it was because of Sam, my son. And I told people that. I said, if you want to, know what it's like to live for someone else, to strive for someone else, to take care of someone else, when you have a mental health issue, I can certainly tell you that. But that was what kept me going forward for a long time, I thought. And I've recently discovered that that's not true. It's something that we all have inside of us. It's that little flame. It is the belief that I have something to give. I have something to provide. I have a skill. I have something that is valuable. And I'm not going to be willing to let anybody take that away from me. To tell someone whose child is mentally ill and in the hospital that it's going to be okay and that you're going to help them and you're going to do this and this and this and provide that person with a sense of hope is an amazing feeling. And it's even more amazing when you're able to make those things happen. And through the networking that I have created in Southwest Washington over the last 13 years, I am able to take what I know to be true and push it to the limits by making the people say, what if this was you? What if this was your child? What if you were the one that was in that room? What if you were the one that was taking that medication? Or the law says, and so for me, it's this flame that burns inside of me that says, things aren't right. I can make them right, and I'm not going to go down without a fight. I'd like to add that we all have that light. It's there. It's inside of every one of us. And people say that it's been extinguished or that it's no longer burning or that someone somewhere has somehow snuffed it out. And I say that's not true. I say, look again. Go into the dark if you have to and look again. It's there and it's burning. And we all have a voice and we all have a right. And I give out this poem called the Desiderata when I go to meet with people at the hospital. And it says, it's still a beautiful world. Be cheerful. Strive to be happy. And if you look around, it's still a beautiful world. And I think that if you try to see the positive, if you try to be the positive, and you try to be cheerful to people rather than being all down and depressed, if you try to see that flame in other people, and make yours burn brighter, that's striving to be happy. It's not material wealth. It's not the kind of car you drive. It's not the kind of house you live in. It's that sense of being positive and being alive and doing something that is worthwhile for your community, for yourself, for your children, for all of us, because we're all in it together.